Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlon Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. Hey, welcome back. Health and Wealth Power Hour. Glad to have you with us this time. I am your host, Harlon Pickett. It is going to be a good one, folks. Y'all want to make sure and hang around for this one. We are going to talk about your health. Hey, what else will we talk about on the Health and Wealth Power Hour, right? But this is going to really get into some interesting stuff because we're going to go a different direction. And even when I tell you the direction we're going to go, you're still probably not going to get it right. We're going to talk to a health technology consultant. Ooh, that sounds impressive, right? And not just that, but this is a retired naval commander. How about that? You never know who is going to be on the Health and Wealth Power Hour, but I'm going to tell you right now, Darlene Greene is joining us today. She is that health technology consultant. Darlene wants to help you take charge of your own health, get out of pain, improve your energy, increase your quality of sleep, reduce systematic inflammation. Got some systematic inflammation? I personally do, so I am very interested in what she has to say. She also wants to easy for me to say, increase your mental clarity and improve your nervous system, lower your anxiety. You anxious out there? You're anxious to hear more, aren't you? Well, get ready because here it comes. Enhance your brain function and improve your cardiovascular function. How can she do all that? Well, let's ask her. Darlene Greene, welcome aboard the Health and Wealth Power Hour.
Good morning, Harlon. Thank you so much for having me. It's a pleasure to be here with you.
Yes, ma'am. It is absolutely a pleasure to have you. Thank you so much for your service to our country. We are very appreciative of what you did for us and being a commander in the Navy. Obviously, that was not an easy trail for you to go. You clearly took a little extra to go there, so it really shows your drive, and we appreciate all that you have done for our country.
I appreciate that. Thank you. It was my pleasure and my honor to serve.
Thank you so much. And let's just jump right into this. So what in the world is a health technology consultant, Darlene?
Absolutely. Well, about a month ago, I would have told you I was a stem cell activation technology consultant because I was working with people and am working with people to elevate a copper peptide in your body, your GHKCU peptide. And by elevating that copper peptide, we activate your own stem cells, not somebody else's coming into your body, not your own pulled out, spun around, and then put back in. The problem is that when you're 30, Harlon, half of your stem cells are dormant. And when you're 60, they're almost all dormant. And so people have been studying this GHKCU copper peptide for years, but the only way they've been getting that elevated is by injection. But 4 injections in a day are not the equivalent of what we're capable of doing through photobiomodulation. So let me talk about photobiomodulation for a second. And let me just say this. I have to talk about copper peptide. I didn't used to, but I do now because the FDA recently came out and said your stem cells, including the ones in your own body, are a drug. And so while we have a patent and we have double-blind placebo-controlled studies that show that our technology elevates and activates stem cells, we can't say that anymore. We can only say that it elevates and activates copper peptide, and that copper peptide elevates and activates stem cells. And that's been proven over the last 50 years. So you'll see me do this little dance to just stay compliant and not get into trouble with the FDA. We want your posting to stay up and not get taken down because they get upset. So let's talk about, let's talk about photobiomodulation. Most people don't think that they know what that word means, but you really do. You know how when you go outside in the sun, your body makes vitamin D.
Yes, ma'am.
Or it makes melanin for a suntan. That is photobiomodulation. That's basically light that is going into your system and changing your chemistry, altering all sorts of things. So what we're doing here is, if I looked at you with night vision goggles on, Harlan, I would see light inside of you, right? Well, that light is reflected back into you using this technology where I basically am putting on a non-transdermal patch. It's the size of a quarter, and it's like a little reflective mirror. And it's got a little lattice structure of nanocrystals. It's hermetically sealed in there, so nothing is going into the skin, or you can actually even wear it on the outside of your clothing. It's reflecting your own light back into you to elevate and activate that copper peptide. If you Googled in PubMed the benefits of copper peptide, you would be astonished to see what you would find. One, it increases stem cells and produces growth factors. It protects lungs, including restoring healthy function in COPD affected individuals. It has an antioxidant and an anti-inflammatory effect. It does amazing things for the brain and nerves, including altering the expression of genes. It induces a strong anti-anxiety and anti-aggression. It induces anti-pain. And then there's anti-cancer benefits that include resetting programmed cell death of human cancer cells, neuroblastoma, leukemia, breast cancer cells, but it doesn't affect the healthy cells. In fact, it inhibits something called NFKBP65, which is believed to promote cancer, and it repairs damaged DNA. It reset 84 genes to growth or cancer inhibition. It's amazing for skin and hair. So improving fine lines, smoothing and reducing photo damage, increasing hair growth. It also accelerates wound healing, including things like the skin, the stomach, the intestines, and it has an amazing effect on the heart, which includes reducing fibrinogen synthesis, which is the top predictor for cardiovascular heart disease, and increasing myostatin, which inhibits heart failure. So all of these things are what you find when you increase GHK-Cu. We know that this little tiny non-transdermal patch increases GHK-Cu. They had approved that for the patent, and there are over 90 clinical studies that prove that it does this. In fact, this was worn, the very first patch. So the company's been around 20 years, and the very first patch was called the Energy Enhancer. Harlan, there were over 300 Olympic athletes wearing the LifeWave patches in the 2008 Olympics. So that's how trusted they are. And why were they wearing it? Because it improved performance. It improved their recovery. They were getting faster swim times the very first time they wore the Energy Enhancers. So what the findings of the studies have shown for this little patch called X39 is the following. Yes, it elevates GHK-Cu. It reduces pain. It reduces inflammation. It supports wound healing and increases energy and vitality. It improves mental clarity. And there's a brain study that I want to talk about in a moment. It enhances sport performance and a faster recovery from exercise. It improves skin appearance. It resets 3,000 to 4,000 genes to a healthier state within 24 hours. And it supports cellular repair. So they did a study. There are two studies I love. There's an anesthesiologist, 40-year physician, who says this is the most significant medical breakthrough in my lifetime. The most significant. The X39 patch is one of the most amazing products in medicine. And why is that? Well, when they did a heart study, well, it wasn't a heart study, it was a vascular system study. In 6 weeks, people that wore this patch, and you wear it 12 hours on, and then you take it off 12 hours because you want your body not to get used to the signal and stop responding. So 12 hours on and then 12 hours off, and then you throw it away and you put on a new patch. They found that in 6 weeks, the cardiovascular system began functioning as if it were 8 weeks younger. 8 weeks younger. In fact, there's a gentleman who wrote a book called How to Reverse Aging, a comprehensive guide to copper peptides by Dr. John Harmon. He captures all the different things that GHK-Cu does in this book. And one of the things he'll talk about is he had a right branch bundle blockage in his heart. That is not treatable. There's no cure. There's no medicine. There's no surgery. You're just going to die faster. And what he found is after wearing the patches for 14 months, his right branch bundle blockage went away. So that's just the heart. The brain, and this is why I got interested in this, and we can tell my origin story in a little bit, but my husband was diagnosed with early Alzheimer's. We went out of country 4 times in a year to try to get IV stem cells and to try to improve, because even the latest drug on the market causes brain bleeds in 50% of the people that have my husband's APOE4 type. All the medicines that they want to give you, they don't actually do anything with the disease. They actually just there's one that's supposed to help with symptoms, but it could actually progress the disease even faster. So lots of issues around the medicines. So I was did a lot of research, and everything was pointing towards stem cells, which we couldn't get here. You can't get stem cells here, human stem cells here. So we went out of country. We didn't see any results. We tried a lot of things, Harlan. We did a complete revamping of the diet. I know you had the doctor that was talking about how dangerous and damaging sugar is. There's a doctor that actually, Dr. Bredesen, who writes a lot about Alzheimer's and the prevention and reversal of Alzheimer's, and he would tell you 60 to 70 to 80% of the people who get Alzheimer's, it's originating with insulin resistance and mold toxicity. And my husband had both. So we worked on all of that. We revamped the diet. We took out the sugar. We took out white flour. We took out alcohol. We took out any kind of sodas. We only included high quality fats and no genetically modified foods. And we did things like hyperbaric chamber. We did ozone therapy. We did a new sleep protocol. We mean, you name it, we did it. We did training, amazing workout training 3 times a week with a trainer, a Pilates instructor, another day. We did it all. His decline continued to the point where he was not even himself anymore. He was sort of a shell of his former self. He was napping 3.5 hours a day. He was falling asleep at 7 o'clock at night. He was completely disengaged from conversation because it was just too challenging for him. He would certainly ask the same questions over and over again. But the biggest thing that hurt my heart was that he was no longer even trying to be funny. And that was core to his personality. So we began using these patches, and in the very first week, he didn't nap at all. He didn't fall asleep at 7 p.m. He watched the whole show. He was so chatty, it was like a dam broke, and he had 2 years of conversation that he wanted to get out. It was unbelievable. He was with it. He was replying quickly and appropriately. He was not asking me the same questions over and over again. Thank you. But best of all, he was back to his original personality. He was funny. He was flirty. And then other things continued to get better as well. He recorded his best deep sleep of 1 hour and 25 minutes, which we'd only been at 15 minutes before. So that was a huge improvement in the second week. Over time, things like he regained the ability to whistle. He regained the ability to drum to the beat. His blood pressure dropped 37 points into a healthy range. And at the 5-month mark, he regained his sense of smell, which he'd lost 15 years ago. Sense of smell is actually an early warning indicator for Alzheimer's. If you lose it, not associated to like COVID or something like that, right? So that was amazing. And then his bald spot, which he'd had since I'd known him 20 years ago, started closing in, and chestnut brown hair is growing in where he'd had silver gray hair. So it's just kind of amazing to see all of the difference. And all of that speaks to what we see in this study that was done in 2019. There was a SciTech study, a double-blind placebo-controlled study. They did EEGs, one EEG before the person's started wearing X39, one 3 weeks later, and one 6 weeks later. And if you can imagine a circle of red everywhere, maybe a little yellow, but just that red is an indicator of inflammation and hypercoherence, which is when there's not good crosstalk between the 2 hemispheres of the brain. It's a symptom of, it's demonstrating also things like ADHD and PTSD and anxiety, right? So in week 3, when they retested, that EEG showed, yellows and greens and blues that had come in, and people were reporting, I'm able to focus more clearly. I'm not so anxious. I'm not so angry. And then at week 6, you find a whole new color map. And the actual findings were the following. Yes, it increased GHKCU, that's important, but it supported cell and nerve regeneration. Now think about that when I'm thinking of my husband, I want that cell and nerve regeneration. It balanced the brain, it improved coherence, it improved the nervous system, it lowered anxiety, and I have my own testimonial around that. It increased brain or decreased brain inflammation, and it improved memory and focus and cognitive brain function and task processing ease and speed. So all of these were the findings of this brain study. So when you think about that as a study, that's impressive. But I got to actually see that happen. I got to see that in the very first weeks. I got to see the changes happen with my husband. And then my own feeling was I'm embarrassed to say this, but I guess I shouldn't be. I guess it should be somewhat expected that if your husband has early Alzheimer's, at some point you might have some issues around anxiety or depression. But I had fallen into a complete state of depression, and I wanted to cry every single day. I also had a broken foot, a sprained ankle. I had been sort of chair bound for months. I was having to ask my husband to bring me water, and Harlan, he couldn't. Like, he didn't know what I meant. He couldn't go get me water. And this was sort of up close and personal to me. For the first time, I realized exactly how declined he was. I think up until then, I've just been doing things for him, and I hadn't really noticed how bad it was. So I was not in a good space. And I found that somewhere well, first of all, there's a patch for pain called Ice Wave. And I can't even begin to describe for you how amazing this patch is. It removed my pain instantly within 15 seconds, something that Percocet and Vicodin and all of these drugs couldn't do. This did with light therapy. Light therapy has been around 5,000 years. People do red light therapy, blue light therapy, infrared sauna light therapy, lots of therapies. So we know light therapy makes a difference, but I absolutely was astonished to the point where I didn't believe it. I literally was like, okay, this just must be the day that my foot stops hurting, right? And but you take them off after 12 hours, and I took them off, and bam, my foot started throbbing again and aching again. And I was like, okay, it's definitely the patches making the difference. So, but I had more energy, I got better sleep, and somewhere in the second or third week, my depression just lifted, and I felt like a new person. I was just able to live in a place of gratitude again. And I'll tell you another thing, Harlan, I have had autoimmune disorders, several. Chronic fatigue syndrome diagnosed in 96, fibromyalgia in 99, POTS, postural orthostatic tachycardia in 2005. And of all of those, for me, I mean, the worst at this point in, about a year ago, was really the POTS. I had to take a blood pressure medicine to increase my blood pressure, fludrocortisone, to increase my blood pressure to keep from passing out. Can you even imagine that? So when I was going to Mexico to get IV stem cells for my husband, I got them for myself, just hoping that I could get rid of this POTS, but it didn't do anything for myself either. I was still passing out. And that, I mean, every time I'd go to stand up, I'd have to hold on. It was really problematic. In the middle of the night, go to the bathroom, I'd have to like stand there for a second because I would almost like pass out. I had actually passed out twice, where I knocked my head, once on a bathtub and once on the corner of a wall. I couldn't even take hot baths anymore because it would just create the fainting sensation.
Huh.
Well, since I've started these patches, I have not used the fludrocortisone once. I am not passing out. I don't have any symptoms of chronic fatigue or fibromyalgia. And I honestly don't know that doctors really understand what those are anyway. And they certainly don't know what the root cause is to try to fix them. They want to throw a medicine. I've heard you talk about this over and over again, and I agree with you 100%. I always feel like when I'm listening to you talk, you're part of my tribe, because you're like, we don't want to just throw medicines and mask symptoms. We need to get to the root of the problem. And what I'll tell you is the power of stem cells are that they can get to the root of whatever the problem. They made you to begin with. They can become anything in your body. They can become bone or muscle or cartilage or fat or a lung or a brain or heart or liver or kidney, anything in your body. And they go where they're needed the most. And I tell this situation that I want all of them going to my husband's brain, right? I want you all into the brain, please. Like, let's go to work there. We need to fix this Alzheimer's, right? But but those stem cells may be saying, well, Darlene, your husband was a 30-year naval aviator. We got to start with his liver. And I just don't know, right? I can't direct them. So we have to just wait for them to do their job. But yeah, I just love that I got to experience my own benefits, and not just mine, like there's family and there's friends. And so how do you get to become a health technology consultant? Well, you first experience your own experience and you become a little bit like a crazy person. Like, I just can't shut up about it, because how is it that I didn't know about this? I'm a little bit salty that I didn't know about this. These patches, the stem cell activation, copper peptide activation leading to the stem cell activation patches, they've been around 4 years. And when I researched and looked for solutions for my husband, I did not find anything about this anywhere. This happened to be one of those things that a friend said, you know, I know you've been out of the country for stem cells. This is really tremendously transforming my family, and I would really love it if you would try it. And then I'm like, what do I have to lose? You know,
Yeah.
same thing with a friend of mine had Parkinson's, tremoring since she's 5 years old. In 3 weeks, her tremors practically completely disappeared. My sister's microscopic colitis for 6 years, practically gone in 3 weeks. So I love that this gets to the root. You don't even have to know what the root of it is, right? A lot of us go to the doctor, and I heard you talking with others around, they go to the doctor after doctor after doctor. Your friend who was talking about, they didn't know, and they were going to put him on a pill, and the pill was going to maybe mess the system. When finally he went to a chiropractor and he found he had a pinched nerve, right? That guest of yours. Well, the same here. You don't have to know what it is. Your stem cells know what it is, and they will go to work and fix it for you, from my perspective. Yeah. And that can be bulging discs. That can be, it's anything.
No, that's it. That's interesting that you said that they'll go where they want to go, and you also, yeah, you're telling them, go to the brain. You need to go to the brain, and I think that's pretty funny. Wait a second, we got to take care of the liver first. You know, we don't know, right? We don't know, and I think that, and I've talked to enough physicians to know that it's frustrating to them sometimes to not know. I may have told this story before, but my wife had a medical issue a number of years ago that they couldn't figure out. And we show up at the doctor one time, and he had just given up. And we were met at the front with our records, with her records. And the doctors, and with a message from the doctor saying good luck to you. He gave up. He
Wow.
gave up. She had had two pretty significant stays in the hospital. He couldn't figure out what was wrong, but he didn't even have the guts to come and tell us himself. He just fired us as patients, or fired her as a patient, because he couldn't figure it out, and gave her no referral, no anything else, just goodbye and good luck. Needless to say, I was devastated. She was devastated. There was no answer, and it was a bad situation. I mean, the good Lord was watching out for us and got us to the right doctor. And he didn't even have to see her. By the time we came to see him, he had already figured it out by looking at her records. He knew what was wrong.
Oh, I love that.
He did a simple sonogram to confirm what he had found. And he said, yeah, there's the problem right there. I can fix this.
Yeah.
So
yeah,
I
I am a bit disillusioned with Western medicine at this point in time. And I would.
Yeah, but that's the problem is they weren't looking for the root, right? They weren't looking for the root cause. And they were just trying to treat the problem without finding the root cause. And so that can be very frustrating. In this case, what you're talking about is you don't even have to know the root cause, because in this case, the stem cells know. But I want to go back to what you said earlier, because I think it's very interesting that you said you wore that patch for 12 hours and your pain went away very quickly, but you took it off and the pain came back.
Yeah, there's a patch that's specifically for pain relief. That's called Ice Wave. That's different than the stem cell activation patch.
Okay.
Ice Wave is just going to take away the pain while you're wearing the patches. Now, the X39 stem cell activation patch, it actually does remove pain, but that's repairing and healing at a cellular level. That does not happen instantly. It doesn't happen overnight. Like, that takes a month for every decade you are old, right?
Okay.
Yeah, you're going to have to really give it some time to go to work. And in fact, one way to speed it up is to where there's a patch called Eon, which is an anti-inflammation patch. And we know that inflammation is the root of so much evil. But we also, what people may not know is that inflammation eats up stem cells. So if you are highly inflamed, and maybe those IV stem cells would have done better for us if we would have been doing something to reduce inflammation in our body, like this patch that reduces inflammation. And maybe the reason that this is working so well is because we are reducing our inflammation while we're increasing our own stem cells. I mean, one of the problems with injections or IV stem cells is that they're limited in their lifespan, right? They're going to go in, they're going to do a little bit, and they're going to die. But these, by activating your own stem cells, you're bringing them back to life and saying, get to work, and you have 1 month for every decade you are old, and then you'll have them activated again, and then you'll just begin aging. It's not like if I gave you a blood pressure medicine and you stop the blood pressure medicine and then boom, your blood pressure goes all the way back up again. It's not like that. This is actually going in and activating those copper peptide, which is activating those stem cells, which is then going to be like that, even if you stop wearing that patch. So yeah, there are people who experience pain relief within 30 to 40 minutes of wearing the X39 stem cell activation, copper peptide activation patch, as well as the anti-inflammation patch. But that's more rare. It usually takes 3 to 6 weeks to notice a difference in energy and sleep and pain and those kinds of things. But people do notice that. We actually ask people to take before pictures because so many are regretful that they hadn't. And if you look at my website, the before and after pictures are remarkable. And I got to experience some of that myself. So I have had rosacea for, I don't know, decade. I don't even know when. I feel like I've had it forever, and dermatologists could not get rid of it. They did give me all sorts of lotions and potions and things to try to do, and antibiotics, which I hate, but nothing really got rid of it. So I had it all over my forehead. It was sort of like an acne breakout and redness. And anytime I put even the highest end creams from Nordstrom's would cause me to feel like it was on fire. And so I kept hoping, they talked about the improvement to the skin as one of the major benefits of copper peptide and your stem cells. And I was just like, okay, come on, baby, let's do this. And it didn't happen month 1, and it didn't happen month 2. And I was like, oh, come on. But month 3, it was gone. My rosacea disappeared. The acne disappeared. My skin was so soft. My cousin told me week 2, my skin is so soft. And I'm like, my skin isn't soft. I'm in month 2. How come you're in week 2 and your skin is so soft? But it just affects people differently, right?
Yeah.
So it took me 3 months to get to where my skin was super soft. I no longer have to lather up with a tub of Cetaphil cream every day or travel with that big honking tub. I don't do that anymore. I'm just really pleased by that. It's just been amazing. And I'm not getting up 4 and 5 times in the middle of the night to pee. I'm sleeping through the night, which is a lovely, lovely thing because I need my sleep. Most people do, right? Most everyone needs sleep and energy.
Yeah, absolutely. And that's obviously a huge issue for so many people, not getting the right sleep. And a lot of that has to do, of course, then with pain, right? Yeah, you're in pain. I know that's a personal thing. I mean, I've got an issue with my shoulder. I know I have an issue with my shoulder. I haven't done what I need to do to take it. And so I'll just turn wrong at night, and all of a sudden it's like, and then I'm awake, and now I gotta try to go back to sleep with a throbbing shoulder, which of course is not going to happen, right?
That's right.
Because when you're in pain, you certainly can't relax and then rest.
Right.
But I'm not the only one out there. Then you've got all the other sleep issues that people have, whether it's sleep apnea or just stress, right? Anxiety. You can't go to sleep because of all those different things. But lack of sleep then just steamrolls into other issues that you
It
can have,
does.
because if you don't get enough sleep, it just really blows up, and the whole thing can, your whole house of cards can fall apart.
You're absolutely right, Harlan. And we have a patch that's specifically for sleep that elevates the melatonin and serotonin, which is also a great thing. One of the things that often is the problem around sleep are hormones. And we've talked about hormones. You've talked about hormones, and you know, one of my most frustrating stories was when I went to my OBGYN and said, I'm in menopause or, you know, premenopause or whatever, but I'm waking up 6 times a night and I can't do, like, this is not going to work for me. I have to sleep. And 6 times a night is just driving me crazy. I'm a little bit loopy and a little nuts in the morning. And her answer was, there's just nothing we can do about that. And you're just going to potentially have these problems for the rest of your life. But I went to my naturopath who said, oh, honey, we can fix that in no time flat. We did bioidentical hormones and bam, I slept through the night and I was fine, you know, no longer had any hot flashes. And I didn't really care about the hot flashes. I cared about the fact that they were waking me up 6 times a night, right?
Yeah.
So, I mean, there's just one of the problems I think is our Western medicine doctors, and this was a friend of mine, a very close friend of mine. So, but they're truly trained in pharmaceutical medicines. Their whole curriculum in school is built by pharmaceutical companies. So if
Right.
it's not a drug or a surgery, they don't really know about it. Now, your chiropractors, your naturopaths, your integrative medicine and functional medicine doctors, they are looking at the body as a system. They are looking at a whole picture and looking at what's causing it and all of the side effects. Okay, what, you know, what can we do? And so I really love that one of the things that our patches are doing is balancing the hormones. That is huge, or improving the gut. The gut brain axis is so powerful. We always think about the brain kind of controlling everything, but your gut sends 7 signals to the brain for every 1 signal the brain is sending to the gut. If you don't think that's an important thing, you know, that's why what we eat is so relevant, but just making sure that our digestion and all of our intestines are working properly.
Yeah, absolutely. It's all tied together, right? There's no doubt about it. It's all tied together. And, you know, one of the things I think that's interesting about health, your overall health, and we even do it whenever we build our health plans, is you've got your physical health, you've got your mental health, and quite honestly, you got your financial health. And all three of those parts are so intertwined with one another in our society. In our society, it's not that way everywhere in the world, but your financial health, you have a problem in your finances, is going to affect your mental health, which in turn is going to affect your physical health. Okay, you have a problem with your physical health, it's going to possibly affect your financial health, which then affects your mental health. And it's just all twist around. In our Western society, those three are so tied together. But here's the negative side of that then. Because of the financial part of that, many times I'm not able to take care of my physical health because the way our healthcare system is set up, if you don't have enough money, you can't get to see the right doctor. And when you do see the doctor, you have waits, or that doctor doesn't actually take care of what's wrong with you because he's just feeding the machine, just continuing to feed that monster. And then you get depressed and then you have anxiety. And it's just a constant churn with all of these things. Because as you mentioned, it's unfortunate, but the training that most physicians receive is based on what our healthcare system is now, based on medications, based on surgeries, because that's what makes the machine run. Those are the things, those are the high cost items that make the machine run. And if I cured you, there would be nothing to feed into the machine. So I must continue to treat you, not to cure you. That's the unfortunate truth of our healthcare system.
I agree. I agree. It's not, so it's no longer really healthcare, it's disease care, right? And let's just keep you on that drug for the rest, that pharmaceutical drug for the rest of your life. What I mean, imagine if, you know, there are thousands and thousands of testimonials around people who were told you have 4 to 6 months to live, and all of a sudden they are fine on these patches. They are, whether it's lung cancer, you can actually see a picture of that on my website. You can see the PET scan before and after, or whether it's Agent Orange leukemia. I have a friend, Robert, he was on his deathbed. Agent Orange veteran told, we're going to give you this pill. It's going to kill you, but it's going to give you a higher quality of life until you die. And instead, he did the patches. And Harlan, in 3 days, he was out of bed, no longer using a wheelchair, no longer on pain medications. In 2 weeks, he was traveling. He has since donated his wheelchair, donated his walker. He is living a high quality of life. His white cell count dropped, it reversed and started dropping. And that's just, so I guess when I think about what the power of these patches are, why aren't they covered by insurance? Wouldn't it make sense? Think of how much their costs would drop if they got people to have their stem cells activated, their inflammation reduced, their glutathione increased. You talked in one of your shows about the blue zones and how people that live the longest in those blue zones up to 100, right? And the diet and all the things that made a difference there. Well, one of the things that they find about people in the blue zones is they have the highest levels of glutathione. And if you're not familiar with glutathione, that's your body's master antioxidant. It's your immune booster. And I became very familiar with that because I had 3 autoimmune disorders in the middle of a pandemic. I am very susceptible to everything. And when I get anything, I get it harder and longer and worse than anyone around me. So I was taking glutathione by IV and orally to boost my body's immune system. But guess what I found out? I found out that an IV of glutathione boosts my body's glutathione levels by 27% for a whopping 7 minutes. 7 minutes. But the patch that we have for glutathione, this patch raises it 300% for 24 hours. And glutathione does all sorts of amazing things, including protect the DNA and help increase cartilage. So there are people that wear the glutathione and the anti-inflammation patch on their knee, bone on bone knee. And they did a study and they found that they did not have to have surgery, replacement knee surgery. All of them did not have to have replacement knee surgery because they grew back cartilage with the stem cell activation patch, the anti-inflammation patch, and the glutathione patch. It also removes spike proteins. Well, guess who's got spike proteins? Everyone who's had the vaccination, anyone who's had COVID. Spike proteins are very damaging to our lungs and our heart and our gut and our brain, and they don't go away on their own. You have to get rid of them. They're a malformed little cell in there, and they don't function properly, and they create all sorts of havoc. And it only takes 2 months of those 3 patches to knock them out. My girlfriend did a live blood cell study where she had 6 slides. Every slide had spike proteins on it. And after 6 weeks, she went back and they were all gone with the exception of one. And it was hiding behind one and probably dead the next day. Like, just amazing.
So we've talked about how these patches obviously can make a difference in someone who's got stuff going on. Okay. You talked about with your husband with early Alzheimer's. You've talked about with your autoimmune diseases. You've talked about folks even had lung issues, all of these different things. Is there a place for it in a perfectly healthy person?
Yes, because if you think about it, what about prevention? You are in a place where you're surrounded daily by toxins in the water, in the food, that's causing inflammation, stress, right? All of those things. So there are a lot of people that are perfectly healthy that take the patches and that are doing this just to prevent disease, prevent Alzheimer's, prevent cardiovascular disease. The fact that you can reverse the age of your vascular system and make it younger and younger, that's a huge incentive for people. And I guess the thing that makes me the happiest, especially as the person who went and spent $10,000 on an IV in Mexico for me and another 10,000 for my husband, and we did that quarterly for a year. This patch, this X39, if you just did the X39 patch, it's $99 for a month. 1 month supply, 30 patches, you put on, take off, $99. It's not going to break the bank. There are some healthcare systems, that can maybe will cover it because if anybody that covers Band-Aids, essentially this is in the general wellness product of a Band-Aid. It's FDA compliant, but there is a place. There's a reason that we're in over 70 countries. Our company is distributing to 70 countries. And there's a reason. I just found out it's September. I listened to a webinar that was Sully as a famous football player. And I think it's Ivory Sully, 5-time NFL Outstanding Special Teams Player of the Year, Ivory Sully. He's not only a huge proponent of them and says a lot of the NFL players are wearing these patches, but he's saying Tom Brady's wearing these patches. And I get it. But again, why isn't it on the front page of the newspaper? Why isn't it on the TV? Why isn't it? Because you know what? Big Pharma and FDA are in bed together, and all of them own the media. And so it's only places like your podcast, Harlan, where people can actually get to the kind of uncover the truth about all the alternatives that are out there, I feel.
Yeah, and I think that's a great point, because until we're able to get these things out to more people in a wider stream, I guess you can say. Yes, we've got podcasts like mine and many others out there that promote a different way of doing things. But even whenever you hear about them, so you have even a football player talking about a former NFL player, that when they bring their voice out there, it still can't get through that. It can't penetrate, right? It can't penetrate through that wall of resistance. So someone you would think would have a bigger voice and a bigger opportunity to get out there, there's so much pushback from that it's very difficult to get that out there. We see the same thing just in the healthcare, health insurance, health solution type world. We're fighting the machine. we're just fighting something that is got so much money and is so ingrained in this country that it's very, very difficult to make a move forward. But that doesn't mean that you can't be part of a grassroots movement. I mean, obviously, there's a lot of folks out there. Now, you talked about some of the studies that are out there for this. So will they find those on your website? Will they find access to them that way? How will they, how would someone go? Because there's people out there that there's zero chance they're going to do it until they really look at it. Some folks are going to say that they're going to kind of be like you were, Darlene. We're going to throw the Hail Mary. Why? Because what the hell else are we going to do? What else are we going to do? So someone's going to hear this and they're going to say, I'm in. I'm in because what else? I've already tried everything else. But there's some folks that are going to say, you know what? I got a little bit going on, but not enough to just do that right now. I want to read all 90 papers.
Yeah. And I will tell you, I have a very dear friend who's a doctor, and she and I were looking at this she was actually a few months ahead of me looking at this. We ended up starting about the same time, but she had been reading the studies for 3 months before she started. She read all 90 clinical studies before she began. And then she has a daughter that had a brain bleed. And so she was actually had an injury with a horse incident. And so she ended up starting it for her and her child and seeing amazing results with them. But yeah, so my website has the patent. You can go see the patent for the X39. You can see all of the 90 clinical studies. You can actually see the owner and inventor, who's just an amazing guy, talking to practitioners and explaining kind of in practitioner language what it's doing. It's above my head, but if you're interested in, understanding from a doctor's perspective, that's great. I actually have 2 doctors that are on these patches. It's interesting to me. They didn't tell me about them though. I asked them about them and they were like, yes, I love the patches, particularly the glutathione patch. I love, and I'm like, well, but they don't bring it up because they can barely even talk about vitamin C helping to protect around a virus without getting in trouble these days, right? So anyway, I find it interesting, and especially when, it's really crazy. Think about this. There was a woman, she had a sinus surgery that went wrong, and it ultimately ended up, she had to have brain surgery, and she ultimately ended up with something called Sluter's neuralgia. And she had 2,400 days of migraines. I mean, just shoot me. 2,400 days of migraines. She started using the Ice Wave patch for pain and the X39, and in 5 minutes, her migraines went away. And that's not the best part of her story. When she's talking on stage talking about this, she actually starts to break down when she talks about her daughter, who was 42 years old and she had caught viral meningitis that left her in a wheelchair with her arms and legs locked up and unable to speak for her whole life. Like as a young child, she had caught this. But on the second day of X39, she lifts her arm over her head and is able to now move both arms and legs. I mean, it's just, kids with autism that are just five. I literally know five who are amazingly improved, gone from kindergarten to fourth grade. That happened in as quickly as 5 weeks. And then over the course of 9 months, has now normal executive reasoning in certain areas from not even registering any executive reasoning at all before. So you kind of name it, and you can find somebody that has a story around it. And I guess I'm with you. Do the homework, jump into the studies. You do whatever, jump on a call with me and a doctor. You can reach out to me on the website and I'll pull you in. You can ask the doctor all the questions that you'd like, and they'll tell you specifically, just like I can tell you specifically, these are the patches I think would be best for your particular solution. But you can do just X39, and that alone will do everything. It just will take longer. It just would take longer, and you have to be patient. I was not patient. I need to supplement and augment and do everything I can. I can't wait for it to just sit and fix that liver, honey. I need to keep going. We need to get stuff up into the brain. And there's some patches very specifically that, like X49. X49 is the only other one that activates stem cells after activating a daughter peptide of copper peptide called AHKCU, but it's specifically found in the brain and the heart and the muscle. And so I know with X49 that it's going to go to the brain, and you always augment. Everything starts with X39 and then you augment with another patch if you need to. You don't have to. You can just wear X39. I don't feel like I have the time for that. And I love some of the other patches like the SP6, which actually does an amazing job of calming and just naturally decreasing cravings, sugar cravings, hunger cravings. It enables me to do intermittent fasting so easily without any kind of drugs. It's the best solution to anybody who's even thinking about the Ozempics of the world. That is so bad for your intestines. This is something that is actually good for the organs. It's good for your thyroid and adrenal glands and kidneys and livers and pancreas and intestines. It balances the hormone. And oh, by the way, it has this wonderful effect of reducing sugar and hunger cravings. Any addictions, actually, other cravings too, alcohol, drugs. It just kind of has some effect in the brain that just kind of calms that all down, or anybody who's addicted to caffeine. I mean, your energy enhancers, this was the very first patch, the one that was worn by all those Olympians, that increases energy and reduces fatigue and muscle soreness by actually increasing beta oxidation. That's the process that is getting more energy from fat burning by improving mitochondrial function. I was actually investigating how do I improve Jim's mitochondrial function when I was trying to figure out how to combat this Alzheimer's. Well, guess what? This patch specifically does that. And oh, by the way, it happens to burn an extra 300 to 600 calories a day too. But it's not like a shot of espresso. It's like an Energizer bunny all day long energy. It just, you just keep going and going and going. And you don't have that afternoon dip where, gosh, I need some iced tea, or I need some chocolate, or I need like a snack or something to just kind of get me over the hump. No, you just kind of are on a full speed ahead setting all day long. I love it. You don't have to have caffeine.
So it looks to me, as I kind of investigate this, I'm out at your website. So for you folks out there listening, it's IamReverseAging.com. That's the letter I, then the word am, reverseaging.com. Looks to be 10 patches that are for folks. And hey, there's even one for your pet.
Yeah. Yeah. In fact, you can actually take the patches off. When you take yours off after 12 hours, you can put them on your pet right then. All of the patches are safe. These patches have no contraindications, Harlan. There's no negative side effects because it's your body optimizing your body. It's light. It's your own light. And so what they find is it's amazing on any living, breathing thing. We've seen people patch fish, turtles, all sorts of critters, cats and dogs, horses. Absolutely, a lot of veterinarians are using them to get animals out of pain. And we've seen them really, even animals on their last leg kind of come back. There are a lot of people there are humans who will be happy to pay whatever for their pets. They'll do it for their pet, or they'll do it for themselves,
They'll do it for
actually.
themselves. Yeah,
And I've had people
absolutely.
start that way. They watch this huge improvement in their pet, and they're like, I guess I ought to try it myself. Yeah, exactly, right. Isn't that just so funny?
It really is. And so I see there's also a couple of therapy myths as well. So tell me a little bit
Yes.
about those, because some people do like to use that. I know that we're actually a big proponent of essential oils as well, and so it appears that that's kind of what they're using, is some essential oils in these myths.
Yes, I love the aromatherapy mist. I do those as well. There's one that's called Shine, and that's what you do in the morning. And then there's another one that's called Dream, and that's what you do at night. And what the Shine does is it actually improves testosterone levels, which is great for not just men, but women too. We actually all need a good dose of testosterone, and it's optimizing. It's not going to make you into a man if you're a woman. It's just going to increase your testosterone to the proper levels. And for most men of a certain age, that is actually too low. And actually, for most women of a certain age, that becomes too low. And when you increase your testosterone, you really feel the benefits of increased energy. So the Shine helps with energy, but it also helps with oxytocin. Oxytocin levels that's your love and cuddle hormone. So guess what? People just feel happier because they're getting that little boost of oxytocin. It reduces stress, resets muscle fibers to a more youthful state. And then the Dream improves relaxation and helps with sleep. And I love the Dream because you just spray it, you breathe it in, and then, man, you just go to sleep. And if you wake up in the middle of the night and you need to, if you're starting to think, you just spray a little and drink, boom, you're out again and you just go to sleep. So I love the two aromatherapy, Miss and Shine, and Shine and Dream, rather. That those are just amazing.
So
In fact, there was a study that showed 3 to 14 days, men doubled their testosterone levels, doubled it in 3 to 14 days of use.
wow.
What a healthy way to get improved hormones, right?
Yeah, absolutely. So I'm sure everyone has the same question that I do here. So we talked about kind of your origin story was, of course, your husband, right?
Yes.
How's he doing today? Today, what are the results today?
So the things that have improved for him have continued to improve. Like the energy level's still high. He's still funny and flirty. Those things are, in fact, I really, somewhere along the way in every one of these presentations, I absolutely need to say Lifeway products are not intended to cure, treat, diagnose, or prevent disease. Like part of the, I have to keep us out of trouble from a company perspective. And so those things have stayed, and I'm and something new happens like every month, but other things have declined, Harlan. So there are, other areas that he's not doing better in. He's not well. He's still very much like an adult toddler. I'm still very much a care provider. And it's very hard. So I'm trying other things. Like I just got a pulsed electromagnetic frequency machine, because that's supposed to be very good for cellular regeneration and potentially the brain. We are certainly continuing on the Dr. Bredesen protocol and plan. We're doing all of the other things as well, from the diet to the exercise, with the hope that this will reverse. There have been really substantial reversals in other people with Alzheimer's, where their whole brain scan was cleared of, it just was gone. Their neuroquant showed things just cleared up. So I'm hopeful, but I'm not relying solely on this. Dr. Bredesen says there's a 36 roof hole. There are 36 holes in the roof when you get Alzheimer's, and you got to go patch all of them to get it to stop. And even if, reversal maybe not possible, but at least stop the progression. And to do that, you got to patch all 36 holes. Well, what are those holes? Well, insulin resistance, one of the holes. Mold toxicity is another hole, potentially Lyme disease. Jim had Epstein-Barr virus. So he had mold, he had insulin resistance, he had Epstein-Barr virus. I don't know what else he had, probably some traumatic brain injuries from 1,200 landings on an aircraft carrier. Who knows how many little TBIs he had from that, or how much fuel and toxicity he had from breathing in, aviation fuel that we need to dump. So we're detoxing, we're doing infrared sauna, we're doing all the things that I know to do. And I'm hopeful, I'm hopeful. I'm also, if he just stayed where he is right now, I'm very grateful because I have him back. Where before he was not even here. He was
Yeah.
just not with me anymore.
Well, and I think that what you're really describing is his state relative to what it was, right?
That's right.
Because
That's
that's what everyone has to keep in mind in any kind of wellness journey, in any kind of reversal of anything, of wherever you're at. Where were you to where you are now? And this was the only thing that y'all found that even did anything.
Oh,
Once again, you
absolutely.
spent thousands, tens of thousands of dollars, they got no results whatsoever.
That's
And
right.
this one did, at least, if nothing else, prolong the time that you'll have with him as him, right?
As
As the
him.
him
Yeah.
that you
Yeah.
knew. And
Yeah. And have him not sleeping all day and have him
yeah,
engaging in conversation. I mean, it's a very sad thing when they're not engaging in conversation because it's just too hard and they just don't talk. I mean, it's sad, especially as young as he's 67. He's young to be just like
yeah.
detached and disengaged. But what's also really helpful, Harlan, being a care provider is not for the weak or faint of
No,
heart.
that's
Like
right.
this is not an easy thing to do. You are, I mean, you have to feed them, you have to dress them, you have to make sure that they shower, you need to do absolutely everything. You have to tell them what they're going to be doing hour to hour of every day. And you can't necessarily leave them alone. You can't travel anymore because it's too disruptive. There's all these things that you can't do. So I'm okay with that now. I wasn't, I wasn't very, I wasn't doing very well with it 8 months ago before the patches because I was so sad. And I know grief kind of comes and goes and things in waves and but it would be very easy to live in a state of grief and resentment and sadness and anger and frustration all day long, every day. So one of the things I will tell you that these patches do by calming my system, by lifting my depression, by reducing my anxiety, is that they help me be a better care provider to him every single hour of every single day.
Well, but let's talk about the other part. You've seen some reversal. You've seen something better. So hope makes such a big difference too, because you didn't have a lot of hope, right? So that makes things worse. It makes things worse for you. It makes you, I won't say your attitude worse, but it makes your depression, your
Yeah.
anxiety, it makes all of those things worse, which then makes your attitude worse, right? It's not an attitude, it's just a self-fulfilling prophecy of what's happening there. But when you start seeing things improve, when you start getting that hope, that changes your whole outlook, which then there's no doubt it can't do anything but help his outlook.
Absolutely. And the other thing that I have had the joy and benefit of doing is helping others with their health.
Yeah.
So there's the silver lining that has come about from this. I would have never discovered this, I don't think, without his Alzheimer's, or I wouldn't have been as interested in even trying it, quite honestly, if we weren't in extremis potentially. But I will tell you that I now have hundreds of people who thank me for being able to move again because they're not in pain again, for they're no longer depressed and suicidal anymore. They are no longer struggling with fibromyalgia. They're no longer living on pain medicines. I mean, when you're getting this kind of feedback, that is intrinsically rewarding. And that is its own little boost of oxytocin every day, right? That's like you're getting love from a community of people who are grateful and thankful that you shared with them this amazing technology.
Yeah, I think there's a lot to be said for that, right? And here's the thing: you're just the messenger. You're not the patch, right? You're not the thing. You're just sharing that information, and that's a beautiful thing because where are they going to hear it at otherwise?
Right.
Right? Where are they going to? Just like you, I mean, you were very blessed that you ran into somebody that kind of knew you were at wit's end, right? And
Right.
you were the perfect guinea pig, right? You were the perfect guinea pig situation because of what was going on.
Yeah. Yeah.
But what I really love about your story though is you wanted it to work, but you didn't necessarily believe it was going to work any
No,
different.
no. I mean, if I was going to believe anything was going to work, I was going to be those IV stem cells in Mexico. Quite honestly, I mean, I ended up spending over $140,000 that year on medical things. I mean, I believe the ozone would work. I believe that the hyperbaric chamber was going to work. 3 times a week we did hyperbaric chamber, and then followed that with ozone spinning therapy. You know, the infrared sauna that we spent to put in the house. I thought that was going to be the thing. But no, none of those things worked. And none of, you know, I have a friend who just challenges everything and thinks that everything is a placebo effect. And I'm like, okay, well, I don't think Jim was really thinking about his hair growing back. You know, he does not have the mental capacity to say, well, I believe that this patch is going to grow my hair back and my bald spot's going to. Honestly, none of us were thinking of that. It didn't occur to us. I didn't think about my hair growing in. I'm too busy being a care provider. But guess what? I have all of these sprouts that are all over the place. I did hope that my rosacea would clear up, but if it was placebo effect, it would have happened in week 2, not month 3.
Well, right. I mean, here's the extra things that happened that you, quite honestly, it wasn't even the reason, right? It wasn't the reason at all that you were
Right.
investing in this, as it were. Now, I think that's very powerful. That's very powerful testimonial to talk about those things. So tell me about somebody else. You don't, obviously we don't have to name names here, but you have all these people that responded to you. Talk about some of the other issues that people have overcome or that have improvements in their lives because of using the different patches.
Yeah, I have a nurse friend of mine who was very skeptical. And the only reason that she even tried it was when I met her for lunch, she was in pain and I was able to patch her for pain and it immediately reduced, like her pain was dramatically improved. And so she's like, okay, there's something to this. I don't get it, but okay, because very steeped in Western tradition, right? Nurse, she's like, I don't know. But anyway, she was at a very serious stage of, you know, gut and intestinal issues and problems, all sorts of issues around. She could barely eat anything. She was having migraines, you know, all of these negatives. And in just about 2 weeks, her gut issues calmed down and she even tested it. She was eating other things that she'd never been able to eat before. And that got dramatically improved. So that was really, really fun. My parents, they didn't notice something right away, but they're 80s and so older, and they found that they got sturdier and stronger. My dad was wobbly. Both of them were fall risk, right? And what happened is, you know, then what happens is my dad's talking to his college buddy, and I get a phone call. We want to be on whatever this is that your dad's on because it's making him stronger and sturdier, and we need to be sturdier too. You know, really cute when 80-year-olds are calling me and saying, like, what do I need to do? I want to do what he's doing. My dad's like a spokesperson. But you have gut, you have migraines, you have people that have, oh, one of my favorite stories is my friend that has the child with a rare genetic disorder and was in fact hyper ADHD on medicine, has been basically bouncing around since birth, very challenging, very difficult, very combative. And in 15 days, all of a sudden was calm, never has been on ADHD medicine again, has gone from kindergarten to upper fourth grade level, and then improved even more since then, and is learning how to do things never before available, talking about living on their own, which is never something that was even considered before. And this is a 16-year-old who was working at a kindergarten level and has now got a 16-year-old executive reasoning. There's the friend of mine whose child is also autistic, nonverbal. The very first day on the patch, when the mom said, I love you, honey, the child said, I love you, mom, back. First time speaking. That was huge. There's all sorts of dental issues. People that have dental issues where, you know, your gum has receded and you've got some exposed enamel. Well, what you ask the dentist, what do we do for that? They're like, there's nothing you can do. There's surgeries, but not really anything you can do for that. But when people go back in, they find that even as quickly as within a month, people are seeing the receding has improved and they've actually have less recession. So all sorts of issues around that. You know, I love the fact that people find that, in fact, people are no longer on their thyroid medicine. People are dropping weight. I actually dropped 10 pounds without even trying. My doctor friend's mother dropped 40 pounds in a month But part of that's hormone balancing and getting rid of inflammation in the gut. And people are actually getting a smaller waist size because the inflammation in the gut is actually takes up a lot of room. You've got people that had blood pressure medicines, they don't have to take them anymore. Cholesterol medicines, they don't have to take them anymore. You know, acne clearing up a lot of teenagers. My niece, who's a teenager, you know, it's cleared up her acne. It's given her, she'll tell you she's smarter in school and she's better on the volleyball court. And she's a freshman and just got named the varsity team most valuable player.
Wow.
And she'll give credit to the patches making her have more energy and stronger, getting her better sleep, having her think better, all of those things. So there's people with knee pain and people with mental health. I mean, mental health is a big one for me because I think of all my military veterans that are so, you know, so struggling. And there are so many people in the world struggling after the virus and all. So it's just, there's not enough we can talk about to talk about that, but getting through I've had PTSD, I've had EMDR, I've had a lot of treatment protocols, talk therapy till I was blue in the face. Nothing was like this. Nothing. I can't even describe how amazing it is. We have a friend, plantar fasciitis, my sister's plantar fasciitis cleared up, my cousin's plantar fasciitis cleared up within just a few weeks. As someone who's had plantar fasciitis surgery on both feet, that was huge, just because they don't have to go through that anymore. Yeah, that people not on thyroid medicines anymore, wounds that healed up, tendons that feel better, acid reflux that disappeared the first day wearing the patch. Acid
Wow.
reflux had been for years, and all of a sudden it's just gone. Right, it's just gone, and she's just like amazed by that.
Yeah. So because there's so many things, all right, it's not, there's the X39 patch. That's kind of what we talked about to start.
That's
As
everybody starts with that. Yeah.
Right. So as we've kind of worked through the show today, we've learned there's lots of other patches. But one of the things you said earlier, and I think it's very important, is that you're willing to have a consultation with somebody to talk about the different ones I guess to kind of lead them in the right direction of what may be right with them. And even if they want to include their physician, correct?
Yeah. Yeah, and I have a doctor you can talk to that's very familiar with the patches and can help with that too. And anybody that's in your audience that reaches out on the website that would like, you know, I can guide them, or we can pull them into a Zoom call with the doctor, and they can guide them too. Because, you know, if you're trying to treat neurological systems and you're as desperate as I am, I can tell you it's X39, X49, Eon, there's a carnosine patch, glutathione, and there's Alavita and the Shine and Dream. That's what I would recommend if you're trying to do it all like I was. If you have arthritis or swollen and painful joints, there are patches for X39, Eon, glutathione, Ice Wave, Shine and Dream. If you are somebody dealing with fast growing rogue cells, which, you know, is code for cancer, X39, Eon, glutathione, Alavita, and carnosine. You know, different thing. If you're trying to rebuild your knee, X39, Eon, glutathione. And if you need Ice Wave for pain, okay. If you're just trying to reduce your A1C and regulate your blood sugar, X39, X49, Eon, and glutathione. So there are different cholesterol, X39, X49, SP6, glutathione, and energy enhancers. There's different patches, but you don't have to do all of them. You can just do X39 if you'll be patient, and you are patient, and you will stay on it until you get your miracle. Patch till you get your miracle, because you know, you may not feel your cells regenerating and your copper peptide elevating and your stem cells activating, and it may take a little bit of time. So you'll need you wanted to have some baseline measurements around your blood work, and then look at it, you know, 6 months later and see the difference. And you'll be able to see, you know, I think it was, I can't even remember, 3 months, maybe, when my husband's blood pressure dropped by 37 points. So, I mean, just, and that was, you know what, we weren't measuring that. That was just, we went for a normal doctor's appointment, and then boom, there it was, boom, just completely dropped. And I was like, wow. The other thing that like I didn't notice and didn't even think about, my husband's had this marble size nodule on his arm for as long as I've known him. It was kind of gross. It was like the largest marble you could think of, almost like a ping pong ball size, but not quite that large, underneath his skin. You could move it around and wiggle it. It didn't hurt him, but it was just like weird. It was just kind of weird. Anyway, At the 4 month mark, it just disappeared. One day I was like, where did it go? It's just gone. It just completely disappeared. So, all sorts of fun things happen.
That's wild. That is wild stuff right there. Wow.
Yeah. 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 My girlfriend, one of the gals who is working on, she's actually taking it for fertility. She is wanting to have a baby, and she's had all sorts of issues and fallopian tube issues and lots of issues. But she'd had a surgery, and she looked down on day 3, her scar was almost invisible. She couldn't believe it. She's just like, that is crazy, because it's been a scar that's been there for years, and all of a sudden she's just watching it disappear before her eyes. So yeah, it does affect everybody differently. So, what is it going to do for you? I don't know. Try it and see. It's not going to do bad things. It's only going to be doing good things. The one thing I would say is this: if you have somebody who has an alien organ in their body, somebody else's organ, from a transplant, you would definitely want to hold hands with the doctor, because it will boost your immune system so dramatically, and that could create issues. They're typically on some immune depressant drugs, right? So that would be something that they would want to be careful about. But we have pregnant women, we have babies, we have also, there are no studies on babies or pregnant women, but all of the people that I know patch their kids and patch their grandparents, and new mothers and pregnant mothers. And in fact, there's a lot to be said for making sure that all of the stem cells are activating properly within a baby inside of a body, right? There's just not enough. When I was pregnant, not enough energy in the world, I felt like. So having a good sleep and good energy during that time was huge.
Yeah, absolutely. Well, Darlene, this has been absolutely amazing to hear these stories and to hear about what you're doing, about the patches. Folks, I'm telling you, if you want to learn more about this, and once again, I've been onto the website here. All the things she's talking about are right here. There's videos to watch. All the clinical studies are right here. The research, the studies, the patents, the science, all the things, the testimonials, as she mentioned earlier, before and after pictures. There's tons of those to look at. If you go through all this and you're ready to talk to her, obviously you can probably just order. You don't have to talk to anybody. You could just do your thing. But if you want to talk to her right here on the website, you can also set that up as well. Don't forget, it's iamreversedaging.com. iamreversedaging.com. They can probably find you on LinkedIn and some of the other social media sites as well. Correct, Darlene?
That's correct. That's correct. Darlene Bennett Greene. Greene has got an E on the end. On Facebook, Darlene Bennett Greene as well. Yeah, and I'll tell you, Harlan, I was a very private person. I think I posted on Facebook when one daughter graduated from the Naval Academy, and another time 3 years later when another daughter graduated from the Air Force Academy, and that was kind of my social footprint. Like, I just did not post ever. Years, decades would go by. I think the previous post, I'd gotten married 20 years ago. So it was really one of those things. So this talking, sharing my vulnerabilities and my own story of like my own depression or my own autoimmune disorders or my husband's Alzheimer's, something that often people kind of hide and keep in the dark, or even just the challenges around being a care provider. It's not a normal thing for me. This is not a comfortable thing for me, but I feel like I'm so passionate about the possibility of what it could do for someone and what it's done for my family, me, my family, and all of my friends, that I feel that it's worth being uncomfortable and sharing it, so that somebody out there who was where I was several years ago today could hear the information and get on board and do something that could change their life. I know that we would be in a different space today if I would have known about this 3 years ago. And I just hope that you have people in your world that will listen and reach out. And anybody that buys from the website, I reach out to them with an email that says, okay, you got to drink a lot of water, drink half your weight in water. And, just like, I'm here for you. And I'll be connected at the hip with you along the way through your journey. Because I want to hear the stories. You're going to have some great success stories, and I want to know what they are.
Yeah, absolutely. That's part of it, right? That's part of on your side of it. That's the satisfaction you get, right? That's the reward that you get, is hearing people's stories about how it's made an impact in their lives.
Yeah, it's really very rewarding, intrinsically rewarding.
Awesome. All right. Thank you again, Darlene. We really appreciate you being on the Health and Wealth Power Hour. Certainly, folks, don't hesitate to go out there and just learn more. You got nothing to lose by going out to IamReversedAging.com, checking it out. Maybe it's right for you, maybe it's not. But once again, I think that the starting point, the price point is low enough that anyone can go out there and just give it a try. Especially if you have reached your ropes end and you just don't know where else to turn. If you've decided that modern medicine and pharmaceuticals are not the answer anymore, then maybe it's time to try something else. Maybe you've actually looked at some of the stem cell technology things out there, and the cost of doing it in other countries, as Darlene's pointed out that she did, is just cost prohibitive. Maybe you cannot do it because of the huge investment that there is. Well, here's another option. Let your own stem cells do the work for you. But we really appreciate you being here. We really appreciate you joining in. And once again, thank you for your service, Darlene. All right, folks. That wraps up another
Thank you,
Health and Wealth
Harlan.
Power Hour. You're very welcome. That wraps up another Health and Wealth Power Hour. Hey, you guys, don't forget to catch us on the last Tuesday of each month as we deep dive into why does healthcare suck? The live audio room on LinkedIn. We do the last Tuesday of every month. Appreciate you keeping up with the Health and Wealth Power Hour. Don't forget you can listen to us on all of the different podcast places, whether you got your Apple, your Google, your Spotify, even out there on YouTube. And if you want to subscribe, go to hwpowerhour.com. That's hwpowerhour.com. Thanks for being with us. We'll catch you next time. We are out.